you're a third year medical student, you don't know whether you want to give USMLE or you don't know whether you want to do NEET. You're kind of confused between those two also. And you're starting at that point.
Mm.
I would still recommend give step one because it will create a foundation for you that is so strong that when you actually end up giving NEET, it's going to help you.
So, hello everyone. Thank you for joining today. We have Dr. Sharan with us. He's a first year internal medicine resident at Cleveland Clinic. After graduating medical school, he worked as a clinical scientist at nference, aiming to standardize healthcare data capture. He hosts the popular The Dog Suit podcast, exploring the intersection of healthcare, business, and technology. He co founded the OTTO Research Initiative and founded the Avani Subir Jhaveri Foundation, both aimed at enhancing global access to basic research methodology. He also continues to explore ways to leverage technology to drive change at scale. So, thank you so much, Dr. Sharan, for joining us today and talking to us about this USMLE journey that you have accomplished and we are aiming to do now. So, thank you, sir.
Thank you so much for that generous introduction. Let me point out, I think that was overly generous, but I appreciate it. I'm happy to be here. Always happy to talk to others on this journey. Um, yeah,
Like, how is the US been treating you right now? Till now, I think it's almost a few months since you joined your residency.
yeah. It's
So
it's
how's
been
it?
6 months. It's been 6 months. I think the initially it was awesome because we lucked out. We had a really nice fall. The weather was nice. Cleveland itself is pretty green. And I think it was a lot of fun. I mean, of course, it's a new country. You're adjusting to things. You're adjusting to living alone. There are a lot of challenges that you come across. And I think um, it was a little rough initially, but I think it gets better with time for sure. That's number one. And I think the last few months it's been snowing. So it's gotten much colder. I'll say that. I am not a fan of the cold. I live in Ahmedabad, or rather, I used to live in Ahmedabad, and for us, winters are one jacket weather. So having to put on 3, 4 layers to walk 5 minutes across one street to get to campus, it's a new experience, but hey, all there for it. So yeah.
Okay.
Um,
Yeah, talking about the weather, it's winters here in J&K and we are all layered up
decked up,
within
yeah,
our houses.
sure.
So I understand, yeah, like that can be difficult to manage.
Yeah.
So talking about the USMLE journey, now that you've like completed everything, you're on the other side of the match. How do you see the process now? How do you think the process was for you?
I think so. Those are two different questions, right? How the process was for me and how I see the process now. The process for me was on a if I zoom out and I look at how my journey versus what everybody else is going through. I think I've been very lucky because my college has been has a pretty it has a tradition of sending people to the States. And so like when I was in first year or second year, all I had to do was ask around. And there was always somebody to talk to about step one or step two, or rotations, something or the other, right? And it was very like the information was available, perspective was available, and I think that really helped me sort of judge and understand what's important, what's not important. Going one step beyond, when we started the Auto Research Initiative, we had over 150 people that we worked with, and they were people from all across the world. Me being me, I had an opportunity to kind of at least talk to them, understand their journey, where they're coming from, understand their perspective, their stories. And I think that really gave another dimension to how I saw the USMLE journey while I was experiencing it myself. It gave me a lot of perspective. It made me very humble. I hope I come across as humble. Sometimes I don't. but it made me very humble about where I've started and where I'm going and what I'm doing at that, what I was doing at that point of time. Um, so I think that's for me, that's how the journey has been. I mean, everybody has a few hiccups here and there. Uh, some people struggle with research, some people struggle with other parts of the application, some people struggle with exams. And for me, step one was that struggle because it was very hard for me to understand go from our system of studying to a completely different system of studying, completely different system of processing and understanding information. Step two was far much more. It was much more fun than step one. I will say that. Um, and then with rotations again, like when I didn't have to do a lot to look for rotations because of COVID. There were only few places that even had rotations open. Um, so uh, that was, that was it. It is what it is. And then so I think that kind of answers my own personal journey. How I see the process, I think it is an incredibly tedious and long journey. Rewarding, yes, but only if you're in it for the right reasons. And the reason I say that is because I feel like you can only get through this whole process if you want to pursue this because you want to pursue it, not because you don't want to pursue something else. Right. If your goal to be in this process or to give the exams and do all of this is to be in the States at least, then you can maybe get through it. Otherwise, there's so many backlogs and so many failures that you will come across that if you're doing it because you don't want to do something else, I feel like you're much more likely to give up. And that has happened. I have a lot of friends who started and like a fraction of them actually went all the way through and completed it. Uh,
But wouldn't you agree that this process is also a gamble? Like it's not really,
sure.
it may not really be because they do not want it or they don't want to do anything else. Like how do you think, one would differentiate in during the match process itself that people are there for the right reasons or not?
You don't differentiate. Again, that's what I'm saying. I'm not saying like you can be insanely smart, give the exams and match and without caring. That can happen. But when I say this, I say it from a person who is in the middle of the bell curve. Right. So you are much more likely to get through and be persistent if you enjoy it and if you're in it for the right reasons. Right. Because there is so much entropy and so much variability in what you put in versus what you get you're much more likely to get disappointed, and then if you're not in it for the right reasons you're much more likely to give up. That's what I meant.
Okay. So we today have Aradhya with us. He's a final year student from ISCOM's J&K, and he has some questions for you regarding your USMLE journey and how you can guide him for the same. So, hi Radhya, please join us.
Good evening, sir. So I'm Shraddha Gupta, a final year student from GAIMS Jammu. And first of all, I would like to thank you for giving us you're doing residency in one of the most competitive phases out there for any medical graduate. So I'm really blessed that I had this opportunity to, have this conversation with you and put out my thoughts as well as thoughts of a general public that are, in on their journey to USMLE. So, sir, my question to you would be like, everyone starts at some point or the another. Like, for example, I'm in final year and I want to give USMLE. So obviously the approach for me would be different than an intern preparing for the same. So what would be your, you know, take on that for someone who's in pre-final or final year of med school?
That's the way I see it, right? I feel like, and this is for anybody, you can run first year, second year, third year, fourth year, final year, you're post intern, resident, whatever. I sincerely think, irrespective of what you're doing, like the first thing you need to kind of get through are the steps, right? Step one and step two. Like try to get ECFME certified, right? Like that's the first thing you need to do. So if you're in pre-final or you're in final year or you're in first year or you're in second year or third year, literally like the first step is step one. It's called step one for a reason. Get the exams out of the way because they take insanely long to prep. They're genuinely difficult exams and they're long exams, right? Step one is an 8-hour exam, step two is a 9-hour exam. And so irrespective, so here's how I'd put it for you. Let's say you're a third year medical student, you don't know whether you want to give USMLE or you don't know whether you want to do NEET. You're kind of confused between those two also. And you're starting at that point.
Yeah.
I would still recommend give step one because it will create a foundation for you that is so strong that when you actually end up giving NEET, it's going to help you, right?
So it'll serve for both the exams. Like there's a
Exactly. So
substantial amount of overlap.
irrespective of which way you go, I think and this is something that a senior of mine told me. He would tell his friends that every medical student should go through UWorld at least. First aid is a reference book, it's more like a dictionary. So people sometimes use it as a textbook, which I don't think is appropriate. It's more like a dictionary that, if you want to look something up, you open it up and you'll find like a very short snippet of whatever concept you're looking up, right? But you want specifically the questions and the concepts, I think they can really change the way you look at medicine. And I sincerely think that every first and second year medical or every medical student should go through at least step one and step two's U world. I think they will consolidate a lot of medical concepts that otherwise might be lost. So even if you do that much and then you start your prep for NEET, I think you would still do well. And I mean, you need to get these steps done anyways for your if you're going to the US. So yeah, I think start there, right? Your research, your uh, everything else comes later. If you end up not pursuing the USMLE path, I feel like those things won't matter anyways. Because if you're staying in India or you're going for NEET, doesn't matter if you have 70 publications on your CV, right? It's going to be an exam that defines where you go. And for you to be able to perform well there, you need a great foundation. And I think step one and step two can give you that foundation as well. So that I feel is a common thing that you should do. And if you're one of those people who are sure that yes, you want to go to the States and you're like looking for CV building advice or whatever, I always tell my juniors that I think the best way to build a CV is to create a difference in the world. Try to drive some kind of change in society, whether it's small, whether it's large. That's up to you. But pick something that you are passionate about, find a way to help people, and then scale it if you can. But that will build your CV, right? Going to conference, like just getting, um, participation trophies, having a box of trophies that say you participated, or having a box of certificates saying that you attended something. That's very replaceable, right? Anybody can do that. See what I mean?
Okay, sir. So that was
So
a great answer. But speaking on those lines, like if you are in the screening committee for, you have to look at various CVs. So according to you, what would make a good CV?
I'll ask you that question, Aradhya. You tell me, what are you doing? You are trying to hire someone as a resident,
As a result,
right?
yeah, right.
Correct? What is your job? If you are in the screening committee and you have a hospital to run, what is your job?
To find the best, to find the
To
best
find
there
the
is.
best,
Yeah,
right? To find the best there is. Now, you also have to understand that you might not be the number one hospital in the world. So the best there is might not want to come to you,
true,
correct?
correct.
So you need to find the best there is that is willing to come to you, correct?
All
Does
right.
that make
Yeah,
sense?
makes sense. Totally.
Right? Okay. Also, let's say you have the best there is that is willing to come to you sitting in front of you, and they have the best scores and the best this and the best that and best everything. Okay. But they're not able, they can't work with other people, or they're extremely egotistical, or they're very difficult to work with. Is that somebody you're going to be able to train for 3 years? Is that somebody you're going to be able to work with for 3 years? Is that somebody you'd want in your hospital, looking after your patients for 3 years? Right. So the way I see it, the most important thing you need to demonstrate is that you have the capacity to work with people and you have the capacity to be able to get things done, right?
Right.
And when you are sitting in front of an interviewer and they are basically trying to understand why they should hire you. Your answer traditionally is, I can work with people and I can get things done. Those are the two skills you want in anybody, right? In any job applicant, those are the two things you want. You want those two things. Now you said those things. How do I know that you're lying or you're saying the truth? You show me evidence. What is that evidence? That's your resume.
Yeah, true.
Make sense? This is
Yes.
basically the fundamentals of any job application or any hiring process, right? And the reason we struggle with it is because we've never interviewed for a position or we've never interviewed for a job offer, right?
So we
So
need to stand out of the, cohort of
how do you
people who
stand
have
out?
applied.
Great. How do you stand out? Is
Mm,
is
so, yeah.
and so this is what you do, right? If you think, do you think having a stack of certificates matters in your job? It might matter. It may look make might make you look like a good medical student, but does it matter? Does it matter? Does it matter in your job? That's the
I
question.
feel that
What are you trying to say when you say I have 50 certificates? What are you trying to say?
it's just that you have
That,
participated in a lot of those events,
that
not
I've been
necessarily that you're
active, I've been
automatic.
curious to know things.
You have certificate. Okay, you are great. You know things. The internet knows things. What did you do with that knowledge?
Yeah, you need to prove that you applied those things as well, where you
So where
learned,
do you
right?
apply those things? You have accumulated a lot of knowledge. Fantastic. What have you done with that knowledge?
Yeah.
Did
So
you
it's
teach
about creating
somebody?
a so it's about creating a difference. That's about it, right?
My question is, did you teach somebody? Did you did you use it for and help somebody? Did you use it and accomplish something? Right.
Yeah.
The certificate is not an achievement. The certificate is a stamp saying that you have gone through an X amount, you've done an X amount of work. You should be able to do Y. That's what it says. But you have to actually go and do Y.
This analogy reminded me of your session on that research thing, which I attended really long back. There, you told the exact same thing that it doesn't matter how many courses you do on how to do research or how to write a paper, etc., etc. It matters where you apply those things that you learn, right? So, like when you're writing paper, you should be able to explain what is happening in the research rather than knowing that this is how we do it.
It's like, Shraddha, you tell me, right? Like, okay, yes, you've done this, you've done that, you've done this. Like knowledge, I feel like, okay, you have had. I don't know whether you've like skipped through the Coursera courses and gone online and looked at the online exam answers and and answered them in. I don't know that, right? How do I know that you actually, if you say that you've done all these courses, how do I know that you actually can apply those skills? Because here's the thing, right? When I'm hiring somebody, I don't care about what you've done before you're coming to me, right? I care about what you're going to do after you come and work for me, right?
Yeah.
And the only reason you need to be tell me what you've done is you're giving me evidence. Ki, look, I know how to do this. Here's why I know how to, and the reason I'm telling you this, here's proof. I've done X, Y, and Z. That's why you are saying that. That's why you need proof essentially. Right.
Right.
Because it doesn't matter to me whether you won, like, yes, you might be the lead guitarist of like a band. Does that help my patients? And then you have to say, yeah, it does because I'm such a great guitarist. It took me so long to master that skill. I understand that, mastering a skill takes time, it takes energy, it takes persistence. and I'm willing to do the same thing for my patients, or I'm willing to do the same thing in medicine, then it makes sense, right? But you telling me that, look, I've been taking piano classes for 12 years. Great. Um, what I mean, we'll call you when we have our annual day celebration. I mean, what else do you want me to say?
So the basic crux of whatever you told us is to like be yourself in a world that is actually trying to make you something else.
Yes.
And I guess that's the biggest accomplishment that someone could have, and that'll definitely make a good CV.
Be yourself and like genuinely ask yourself, why is the world different today because of me? And if you don't have a good answer to that, maybe try figuring it out, try to think about it. And look, it's not, and it has nothing to do with scale. It's not about, okay, I want to change the whole world right now. It can be something small. Right now, we run the Dog Suit, which is a podcast, right? Now, Mohit and I don't, we never think about, okay, how many people are viewing our views or how many people are looking at, our podcasts. But both Mohit and I understand that when we do that conversation, when we have that conversation, first of all, it changes my life, it changes his life because we get a lot of perspective. Even if one person listens to those things, listens to an episode, they will learn 50 new things, right? And for us, we are creating art. That's how I see it. And we are changing something in the world, contributing to the world, we're changing something in the world. We're not passively consuming. We are contributing in our own little way. Whether it changes the world, whether it helps somebody, we are try that's why we do it, right? But it doesn't the scale should not be the reason why you hold back or you feel like, oh, I should do this or shouldn't do this. The point is to
That is
start.
so true. Yeah.
Does that make sense?
So it does to me. I mean, these points like they really help you, especially when you're in your initial stages, so that you learn right now that what really should matter when you apply, and whether you should or not.
And look, guys, the best thing that I can give you is my perspective. There is nothing else that I can give you beyond that, right? I can't give you a list of, okay, do this, then do that, then do this, then do that, because the variables that you are playing with and the variables I'm playing with are very different, right? Our coordinates are different. Where I've started, where you are started, you might have certain advantages that I don't. You might know certain people that I don't. You might have certain perspectives that I don't. Right. So my
Right.
all I can do, the best thing I can do for you is maybe share my perspective and maybe give you a new way of looking at the same things, right? As opposed to giving you like do this and that and this and then that, because that might not be appropriate for you. And it might not be appropriate for the people listening, right? So yeah.
Yeah. Thank you. Rather, do you have any other questions?
Yeah, no, I guess that was it from my end. Thank you, Dr. Sharan, for answering my queries, and I hope we have answered the queries of a lot of people out there who had similar questions just like I did.
Sure.
So thank you so much, sir, for joining today, and thank you so much for your insights.
Happy to be here.